Hi.
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 So Rana, when you're do it, do
Usha, can you just send me the SAS link, please, on WhatsApp?
Okay.
we're all good to go.
Yes, we
With
are
our
ready.
teeth brushed and flossed.
Okay, I hope am I clear? Can you guys hear me?
A little
Oh,
louder,
it's my
please.
meeting.
We'll all mute our mics here.
I'm not sure if the sound is clear. Is the sound clear?
Little louder
it
would
is
be
clear.
better, Rana.
Okay. All right. Is this okay?
Yeah, that's fine. Just that if you can ask the guests to mute their mics and only turn it on when you are talking so that it will be a better resolution on the meeting. So I'm going to turn mine off.
Okay, sound. All right. So could you please, guys, just switch off the mics so we can be starting. I'll just start with a little bit of introduction about myself. My name is Dr. Rana Sindi.
Can you come with us?
No? Okay, so I'll start with a bit of introduction about myself. So my name is Dr. Rana Sindi. I'm a dentist. I've studied dentistry for 5 years in the United Arab Emirates. Before that, and then after graduating, I did my internship here in Bahrain. After that, I was qualified. I took my membership in primary dental care, which is basically qualifies me to be an advanced general dentist. I'm currently doing a pediatric residency in the Ministry of Health, Bahrain. I'm also a member of the PMO team in the autonomy. At least that's the new direction of the Ministry of Health, in which the health centers are going to be a part of an autonomy. Basically, the health centers will separate from the Ministry of Health. Anyways, so but like as primarily I am currently only doing pediatric dentistry. So it's lovely to have everyone here. As just for the questions that were highlighted by Shireen, and she would like me to answer for some of the questions that were discussed. So studying dentistry, it's independent of studying medicine. So you don't have to do medicine to be a dentist. It is generally, most places in the world, it is a 5-year study course. Some places 6 years, because as dentistry is part of the, or at least your oral care is part of your whole body. So you'd be surprised that it actually, you need to go through a lot of the systems of the body in order to be a dentist. So like we do highlight a lot of the same content as the medical doctors. And then in the final 3 years, we do specialize in dentistry. So that would that's where the differences come in. Now, your oral care, of course, is part of your total body care. And as medicine progresses, we do find out that a lot of the general medical issues like hypertension, diabetes, cardiac diseases, they're all linked to your oral care. So although it is a specialized field by itself, that you can't say that your oral care does not affect your general well-being. And that is especially true for adults and children. Now, noteworthy, just so the general, well, I see like the general population, like the general people, the general age range of the population. I'm guessing you guys are moms, and then some of you are like closer to the middle age range. So like it is noteworthy to say that even it's things as simple as if you are diabetic, or if you do have any problems with your gums, especially your gums, it is now a dentist responsibility to refer you to get your blood sugar screened, because it might be the first signs of diabetes. So so this is just to highlight that how things are interrelated. Now, to start off, I'm not sure exactly if you guys have any questions or anything, but again, as a lot of you are mothers, your children's oral health care as well is an integral part of their general well-being, not only their confidence as well as or their breath, but as well as the development of the secondary teeth, or as we call them, your permanent teeth. So having a neglected dentition during childhood can directly directly affect neglection of your teeth as an adult. Also, having multiple teeth extracted as a child can influence your alignment of the teeth, as well as um, uh, the general condition of the oral health care. Now, I will start with just answering some of the questions. If you guys have any questions before I start answering the questions that were sent to me, I would be more than happy to address them. Okay. I'm not sure if the microphone is microphone working. Okay, so if no one has any questions, so I guess we can move on. So I have a list of questions that were given to me by Shireen. So I'm just going to start with just addressing some of the issues that you guys faced. Well, the first question is there's an adult tooth that's been missing for a long time. And if I'm not mistaken, the child was like 9 years old or something, and he lost his tooth a while back. So is that a concern? It is definitely a concern, especially if it's in a front tooth. If well, the first and foremost, obviously, is the self-confidence issue that would come with a child without a missing front tooth. The second of all is the longer you leave the space unoccupied by any tooth, you are also the alignment of the front and upper tooth might change. So you even might get the neighboring teeth drifting mesially or to the right or to the left, closing the space that is required for the permanent restoration or replacement in the future. That's one thing. The other thing that is also noteworthy is that when the tooth is missing, the bone starts resorbing. All right, so having a missing tooth that's there for a long time, what immediately happens over time is that the bone starts to decrease in width. Now, that decrease in width of the bone would limit his treatment options later on. So if he wants to get, for instance, an implant, he will need to do bone augmentation in order to be able to put the implant in. If he wants to do just something as simple as like a porcelain tooth, he will need to make up for the bone that is lost. So the longer you leave it, the more complicated it gets. The second question is the child that's sucking his thumb and he has wounds in his gingiva at home or in his gums at home. So what are the things that we can do? Generally, the oral tissues regenerate really quickly. Unlike the skin, which generally takes 7 days, within 2 to 3 days, most of the superficial lacerations on the gums are healed. So the best thing is to do is just to keep it clean, avoid things that might stimulate pain, like hot foods or sour foods or even spicy food, and keeping the area generally clean. It would heal in no time. However, if the child has a bit of discomfort, whether it would be pain or anything, then some oral gels may be indicated just to relieve the pain so he can eat normally. Right. Next question was about iron deficiency and tooth decay. Does iron deficiency cause tooth decay? And the answer is no, it does not. Iron deficiency, however, iron supplements may cause staining of the teeth, but are they directly related? I would say no. Now, the next set of questions is about braces. A child getting braces, what is the correct age in which a child is supposed to get braces? Generally, we do not recommend braces unless all the permanent teeth have erupted, which is almost around 14 for most kids. where they would have all their permanent teeth erupted, which means that all their milk teeth would be taken out by then. And that's when the braces, that's a good time to put braces. The consultations with an orthodontist, however, which means the dentist or the specialized field of dentistry that puts the braces on, should start around 9 years of age. And the reason for that is because there are some small problems can be solved by something called an interceptive orthodontic treatments, which means that the earlier we intervene with like a small or simple removable device, we will be able to avoid the problem in the future. So that's something that, like you would probably want to put in mind if you do have a child, is to take them for an early consultation if you do feel there's something abnormal in the development of the child. Now, the consultation can either be with a pediatric dentist, or it can be with an orthodontist, or just your general, your family dentist, and then he can direct you to to which specialty that you should go. Next question is how to remove plaque. Now, it is noteworthy to know that there's a difference between plaque and calculus. And the plaque is the layer of, it's a layer of food, bacteria, debris, and the layer of plaque accumulates every few hours. Okay, now that's different than the hard deposits that's around the tooth, and that is called calculus. The layer of plaque can be effectively removed by toothbrushing. So just normal regular toothbrushing would remove that plaque layer, and that's a layer that builds up throughout the day. As opposed to the hard stuff, like if I'm sure some of you might have noticed it on some people, that when you put your tongue in the backside of your teeth, you will feel like some kind of roughness, and that's the calculus deposits. Now, that happens because of the plaque layer, which I said is a normal layer that generally accumulates every few hours. When that layer gets mineralized, which means that when it takes in some fluoride and calcium, either from the saliva or the toothpaste, it starts forming like hard deposits around the teeth. These deposits, they harbor bacteria, and they do cause gum disease. So they have to be regularly cleaned. Now, a very common question that most people would have that is, you might have two people who have the same oral practices, but some of them, the calculus or the hard yellow deposits accumulates faster than the other person. And that the reason for that is that there is a predisposition on what type of saliva you have, and a genetic predisposition for calculus builds up. So some people might need regular cleaning every 6 months, and some people every year. So the whole idea is you need to get your teeth cleaned every 6 months is a very old concept. Well, a fun story to actually tell you guys is that that concept was developed in the US by insurance companies to make money out of people in order to visit dentistry. So then if you take it back to the original guidelines, then the patients should visit the dentist according to their risk. Do you have a high caries risk or a high dental disease risk, or do you have a low dental disease risk? So then the follow-ups can range between 3 months, 6 months, 12 months, or even every 2 years. So that's a fun fact if you guys want to know. So like that concept is that you have to visit your dentist every 6 months is it's very much still practiced in the Middle East, unfortunately, but it's for most places it is it's quite old.
Has got a dentist. I don't know. She's having a live Zoom chat. If you have any questions, you can ask and she'll answer.
Okay. Do you have any question? Okay, so feel free to write the questions if you do have any questions in the middle. So I'm gonna go to the next question, which was about daily mouthwash use for kids. Now, for children, it is generally not recommended for a kid less than 7 years to use mouthwash, and the reason for that is because they are worried about the child not being able to effectively spit it out. Now, again, that only would probably depend on the child's ability to spit out the excess or not. The daily mouthwash is usually safe, especially if it's used for the right purpose. Most of the preparation in the daily mouthwash is sodium fluoride, which is fluoride in its sense, and it's usually given for, and it's not indicated honestly for most kids, unless the child has what we call increased risk for dental disease or dental decay, and that's generally assessed by the dentist. So if he does have that, then daily mouthwashes would probably be recommended. Otherwise, using a fluoridated, age-appropriate toothpaste is generally suffice. And the next question is, the child lost his tooth at the age of 2 months, and he is now 7. So is there any problem with that? Well, generally, if the tooth is a front tooth, and I'm talking about the 4 front teeth, which are similar for adults and kids, like the 4 front ones, there's usually it's not a big deal, if I put it that way. I mean, it will not affect the alignment of the permanent teeth. And I'm talking about the 4 front teeth, which for a lot of kids are the teeth that are susceptible to caries because of prolonged milk feeding. So they become more susceptible to dental decay. Now, the child is now 7. I'm not sure if his teeth have come out or not. But generally, losing your milk tooth at a very early age will cause your permanent teeth to delay. That delay is absolutely normal. It's possibly nothing to worry about, but I think it's safe to say that when the milk teeth are removed before their time, we generally like to tell the parents to expect some kind of delay in the eruption of the permanent teeth. The reason for that's quite practical, but if you guys are interested, is because the roots of the baby teeth guide the adult teeth to come out in its right position. So now if you can imagine, that acts as a guide. So if you lose your guide, it will generally take longer to figure out where to erupt in the mouth. So that's simply how, like, in a very simplified way. So that's like the logic behind it. And the last question I have is, there's an adult using toothpaste for kids. A kid using an adult toothpaste. So there's a child who's using an adult toothpaste. Is there a problem with that? Now, again, it all depends on how he's using the toothpaste. Is more important than what kind of toothpaste is he using. That is the amount of toothpaste he is using. And how is he using the toothpaste. Now, again, another fun fact that most people are oblivious to is that toothpaste in kids and adults should not be rinsed thoroughly after. And I think that's one of the mistakes we kind of grew up with. Like, personally, I can't brush my teeth without rinsing my mouth after. But it is not the correct practice, especially for kids. The reason being is that you get all this, the fluoride in the toothpaste that is supposed to be in contact with your tooth, so it can, the teeth can uptake the fluoride, right, and therefore get harder or healthier, if you want to put it that way. Now, when you rinse your mouth with water after, especially for kids, you lose that effect. So now now the fluoride isn't as effective as it is when you only spit it out. So that's one of the things that we are generally trying to change. We always tell the parents, spit and don't rinse. And then, which raises another concern, is is my child taking too much toothpaste? Now they did have, and this is where you have like the organic moms and the other sect who are linking a study is that excessive fluoride in the body would cause like thyroid problems and that. And we always say and that that the fluoride used in toothpaste is a topical effect, which means it's unless you are going to swallow tubes and tubes of fluoride or my tubes and tubes of toothpaste, it only works in your mouth, and you're supposed to spit out all the rest of the fluoride. So, and leaving very small concentration in your saliva, which is meant to harden your teeth. So that's where like the controversy comes from. And is it correct practice to not use fluoridated toothpaste? Absolutely not, unless you are very on unless you are following up with your child meticulously and he has meticulous oral hygiene. It is always advisable to use a fluoridated toothpaste because it helps remineralize any initial dental decay. So that's where we say fluoride prevents progression or prevents decay. That is it for the questions that have been sent to me. I'll be happy to answer or discuss any topics or any questions that you guys have.
Rana, I
I'm
have
gonna
one
leave the
question
floor
for
open
you.
for any questions.
You know, I'm always confused with this whole thing about flossing. When we grew up, we didn't even know this word flossing till much later that flossing is a must. And so what is flossing and how important that is? And, they just sell something, it looks like thread in the supermarket as a floss thing. But is there a method to use it? How is it used?
Okay, that's a good question. On flossing and well, why is it a big deal? Now, as you know, that the teeth are aligned like right next to each other, just like your fingers, right? And then not everyone has the same contact between their teeth. So some of us have that, some of us have that, and some of us have really tight contact, and some of us have this, which is like overlapping teeth. Yeah. So toothbrushing alone using a normal toothbrush or an electric toothbrush would only get rid of 60% of the food debris or the plaque that is accumulated on the surface of the teeth, leaving 40% in the areas between the teeth that the toothbrush cannot get to. And that's where we have a lot of patients say, I brush my teeth 3 times a day. I am using a fluoride toothpaste, but I am still getting cavities between my teeth. And that is sometimes this is one of the reasons that's like an aha moment for a lot of the patients. And they're like, oh, okay, I didn't know. But if you really think about it, like the contact between these 2 teeth is quite a significant surface. Now the methods of flossing, there's a lot of methods. So one of the common ones is the floss. It's a common and cheapest one, and it's usually wrapped around your 2 index fingers. Now I'm holding the phone right here, so like maybe this is, so basically you take the piece of string and you wrap it around 2 fingers, and then gently either put it in between the teeth and out, or put it in between the teeth and then pull it out in order to not hurt the gums. Now, other interdental aids have been introduced. And again, it depends on whether your contacts are like that, which is really tight, like that, which are okay, and like that, which means you have like gaps between your teeth. And then you can use these little interdental brushes. They come in different sizes. That's helpful. And lastly, which is the easier way, is to use the water flosser or water pick. And that's like there's new advertising campaigns on that. It's usually high velocity water, so it's like very powerful very high pressure water, and with a small tip. So when that's directed in the spaces between your teeth, it causes any food debris or whatever to dislodge, therefore cleaning the area between your teeth. So I hope that was comprehensive.
Thank you.
You know, I
So
just
how
want
often, I mean, sorry, is flossing necessary every day? Is that what is advised?
Yeah, that's advised every day, once a day before bed.
Okay.
Okay.
one of the tips I was given by somebody close to me was to avoid getting lazy. You know, when you're sleepy and you have to use the floss, you tend to put it off. So keep it next to you while you're watching television in the night, and so that you are able to do it every day.
Yeah, like before. Yeah,
I got
we
from
don't
my
have
coach.
reminders was for
Then
whatever
the
we're
other thing I learned recently, because I went for a tooth cleanup after some 20 years. I didn't know I had to go to the dentist to clean my teeth every year. Strangely, there are no cavities. I don't know what I did right, except for compulsive brushing twice a day or thrice a day. But they taught me how to brush also. I, the cleaning and all, the nurse took me aside and she said, you should do top down, top down, top down, X number of times in each segment of the teeth, she said.
Yeah.
Third thing which I'm asking you is, you are saying you should leave some of the fluoride of the toothpaste to give you protection, but you must have at least one rinse, right?
Generally, look, especially for kids, it is we just tend to say not even one rinse, spit and don't rinse, and that's
Oh, really?
yeah, just
Oh
spit,
my.
don't rinse. And
I'm hearing it for the first time.
and then and then you just what you can do is you are going to control the amount of toothpaste in the brush. So usually you don't need that. You know how like we're just so accustomed to squeezing that long line across the
Yeah.
brush, and you generally don't need that much.
Last, one more question I have. So for the adults, are we allowed to rinse, or are we also supposed to spit and not rinse?
You can spit and not rinse. And I guess that you generally should spit and not rinse, but I know like with time, it's really difficult because we're so accustomed to rinsing. And like that's something that even I can't do. But like when I see my kids are perfectly able to spit and they don't feel that urge to rinse. Whereas like I can't spit, like I have to rinse. And that's, I think it's just because I've just gotten used to it and I just don't know how to do it otherwise. There's a question about electric toothbrush. So I'm just gonna, like, someone has typed in that question. Electric toothbrush is definitely recommended compared to the conventional toothbrush, especially for kids. But if you do get an electric toothbrush for your children or for yourself, you would want a rotating head as opposed to just a vibrating head, because the vibrating head isn't going to do much. But then the rotating head is the one that's going to help clean up, like scrub the surfaces. So that's a fun fact that I guess everyone should know when selecting the electric toothbrush.
Hi, Rana. How often should the electric toothbrush head be replaced?
Generally, the machine doesn't need to be replaced, but the tip or the
The
brush,
head.
the head,
Yes.
every
The
3
head,
months.
yes.
Yeah, every 3 months or after you get acutely sick. So whenever you have like,
I'm sorry?
after you get sick, like whenever you're sick, like after an episode of like the flu, it is recommended to change your toothbrush, or every 3 months.
Right. The other thing I have heard on is fluoride. Now the water is fluoridated, so we are consuming fluoridated water. And there was a concern by a certain, I come from Sri Lanka, and the Sri Lanka Dental Association was concerned on the content of fluoride in toothpaste, because over fluoridation is also a concern to oral health. Am I right?
Yeah. So that's again, so that'll again, this is one of the things that are specific to which area you come from. Generally, you find that some children from some areas where the water is fluoridated, and now I'm quite confident that the Middle East water is not fluoridated, and even our bottled waters are not fluoridated. However, where areas where there is fluoride in the water, that can like excessive fluoride is as bad as no fluoride, so that can cause a lot of harm to the tooth as well. So in areas where the water is already fluoridated, you should switch to fluoride free toothpaste, or have toothpaste with minimum fluoride content. Again, the risk is dependent on the area, and then most of the water, because the water in Sri Lanka, it depends on if you drink bottled water or you're going to drink the tap water. So, and that's like, and similarly, there's a lot of areas like the areas in Yemen where the water has a high fluoride content, and that can cause like discoloration of the teeth and stuff. So like fluoride is good, but excessive fluoride has adverse effects.
I have another question regards cosmetic dentistry.
Yeah.
Like, like when do you get into it? Why do you get into it?
Well, honestly, I'm very much against it. I'm like the wrong person to speak to about cosmetic dentistry, because I feel like it's advertised as like as a positive thing, whereas most of the places that do cosmetic dentistry here, they look at just the cosmetic part, but not the biology of the tissue, which in long term would cause way more problems. Especially like you have to respect the biology of the tissue, you know what I mean? And there's and then I don't want to go into the nitty-gritties of things, but when you are going into cosmetology, or like veneers or Hollywood smiles, there has to be strict indications to why you need it. I mean, not everyone needs a Hollywood smile, like you might want one, but you don't need one. And sometimes there's a lot of conservative approaches into bettering your smile without having to stick on, veneers or porcelain and stuff like that. So that's generally my take on it. So
Rana, this is a question which is very different from pediatrics. It's really for the older sector.
yeah.
Now, we have bridges in the teeth. They just do bridges, or you can have a transplant. They put transplant. What do you call? They put artificial tooth and just implant. So which one do you think? Why do people do differently? Why are we having two options?
Well, again, it's
Everyone doesn't know. If I'm asked which one do I want, I don't know.
See, that will have to depend on a lot of factors. I mean, you have to consider the age, you have to consider the any medical problems related to it. Are you willing to undergo surgery to do the implant? Like there's a list of indications and intraoral examinations that have to be done before choosing that. I mean, like, okay, the patient's choice is always a factor. But then sometimes the condition of the teeth, the condition of the bone, the jaw, or the medical condition of the patient does not help that choice, So we as dentists, we have to, after like full examination and taking history, then we can give you the choice of whether or not you should go for an implant or whether you should just go for a regular bridge.
What I'm asking is, if I'm given a choice, which one should I choose? I don't know.
Well, it depends. I mean, I can't tell you it, but it depends on which tooth are you replacing. Do you have any medical condition?
When you say medical condition, you're talking about a heart problem or a diabetes or something like that.
Diabetes. Exactly. Yeah. Because surgery, right? Implants for adults. Well, I know that the only there's a Dr. Talal Al-Alawi, and he's a qualified implantologist. And well, That's the only one I know who was qualified implantologist in Bahrain, as far as I'm concerned. I put that. So yeah, so back to your question. How would you know that which one should you choose? Again, it depends. Like, what is your budget? Which tooth are you replacing? What is the condition of the teeth that are next to the, like, are they moving? Do you have gum disease? You know, like, are you willing to go to surgery? How is your oral hygiene like? Honestly, I can't answer that question for you without like having you in the clinic after like full examination, diagnosis, x-rays, and then I can tell you which one I would recommend for you. So like, sorry, can't help you there.
Thank you.
I have a pediatric question.
Yeah.
When I was a kid, and it happened to my daughter as well, by the time we were about 11, 12, you know, all the 4 teeth were out.
Yeah.
They were out, protruding, and then we had to go through the torture of 2 of the side teeth to make space for the rest of it to go in and spread out correctly. It happened to me and my daughter. I just want to know how to make sure my grandchildren don't go through that torture.
Make sure she marries someone.
Anna, George, and I share 2 grandkids between us.
Oh, okay, wow. I mean, like, the best advice I'd give you is make sure she marries someone with good teeth, because things like that
it's genetic.
This is genetic predisposition. You know, like having a small jaw. That's
Yeah.
generally where you'd have like the canine is coming out from the jaw. Yeah, no for it.
All right.
So, yeah.
All right. Tooth alignment, one of the criteria for selection of spouse.
Yeah, definitely.
Good point. Good point.
Yeah. Thank you.
You're most welcome. So just if anyone, does anyone have any other questions?
Rana, this is a question not related to teeth, but related to your career. What made the choice into dentistry, or what drove you to dentistry?
My dad. I mean, I would say
he's a dentist.
Yeah, no, my dad is not a dentist, but my dad is a medical doctor, and all my siblings are doctors. So I wanted to be a doctor, but then he's like, "How about dentistry? Because it's different and it's easier." And well, boy, was he not right. I mean, if you just this is basically where I am. I have some exams coming up, so definitely not easier, you know. At the end of the day, it's a medical science, and as all medical sciences, there's always more exams. There's always more things to do. There's always like, it's something that's constantly updated. So in order, and for me, like one of the criteria of being a good any medical profession really is just to be constantly updated, because medicine is so ever changing. You know, it's not unlike anything else where like you'd have designs or whatever. Like things are almost the same concepts. But when it comes to like things like medicine, it's constantly changing. So like if you're not constantly updated with what are the new guidelines or research, then you'd probably compromise the service that you'd be giving for your patients.
And I had asked you a question previously, the fact that, you know, when there are sub specialties of medicine like neuro, ortho, obs and gynae, they're all housed in the hospital, but dentistry is away from the hospital. So why isn't it considered a component of, I mean, it's a part of the body, right? Why isn't it a part of main hospitals? I mean,
yeah, it is a part of main hospitals, but generally you'd find, because like medicine, you'd find dentistry, it's split into a lot of specialties. So when we graduate, you're just a general dentist, and then you have like implantology, which is where you put like the screws in your mouth to have fake teeth. You can have a pediatric dentist, you can have a cosmetologist, a restorative dentist, and all of that, and an endodontist, which is a doctor specialized in root canal treatments and whatnot. So then you have all these different specialties. Usually, if you the part that is seen in hospital is oral and maxillofacial surgery, and that's the specialty where is most integrated in big hospitals like Salmania, BDF, and stuff. And then the rest of the dental department you'd probably find in a separate. So yeah, if there is a component or there is a specialty in dentistry that is very much related to hospitals.
There's a question. I think there were two questions on the chat. I can't access it. I'm on the iPad, unfortunately.
There's what? Sorry, excuse me. There's there. Yeah, I saw more questions, but I can't access this because I'm on my phone as well. So like if whoever wrote the question, oh, wait a second, let me see. Oh, okay, I saw the chat. Okay, never mind.
I suggest raising your hand and asking Rana. That might be a better option because I'm challenged.
No, that's fine. I saw it. What can be done to the wound? I think we answered that already. I told you that the wounds. Thank you for whoever is wishing me luck on my exams. In regards to the wound, but just keep it clean. Nothing can be done, especially at 7 months. I think maybe she missed the answer to that questions earlier. So you have a baby that's 7 months with wounds on his gums. Keep the area clean. It should resolve. If it does not resolve within 10 days, then you should really take him to a pediatric dentist or your general medical doctor or family doctor, and then he will be able to refer you to whoever is suitable to see it. But generally, nothing is done. Keep the area nice and clean, and it should heal within a few days.
Do you keep the gum clean?
How do you clean the gum?
How do you keep it clean? You said keep the gum clean.
Keep it clean. Generally, just make sure that there are some gum wipes that you can purchase. Yeah. Okay. Otherwise, just with water, gauze and water, clean water, just wipe the gums after every feed, just to make sure that it's not contaminated. At that age, you don't even need to use any. Well, the child is not eating, right? So you probably don't even need to use anything for oral care. All right, so guys, if no one else has any questions, I'm sorry, but I have
just one thing I want to ask you, Rana, is on sodium bicarbonate. I have seen sodium bicarbonate toothpaste, and I was told by my oral hygienist to keep away from sodium bicarbonate.
Are you asking about bicarbonate toothpaste?
Yes, I've heard of it, and then I was talking to the oral hygienist, and she said avoid using it. It's abrasive. She was referring to sodium bicarbonate powder.
The voice is not very clear, but basically because bicarbonate toothpaste is abrasive.
Yeah, that's what she told me.
Yeah, it's abrasive to natural teeth. So that's why it's better to use just a regular toothpaste because of the size of the abrasive particles. And normal toothpaste is very small. That's enough to remove the plaque layer without damaging the teeth. And then you have all that like stuff with the charcoal toothpaste. I was going to come to that with the charcoal toothpaste and bicarbonate toothpaste and all of that. A lot of them are very abrasive to the teeth, so they can wear off the enamel layer, which is the outermost covering of the teeth.
Then why do they make these? What are these specialized toothpaste for?
It's an advertising scam. I mean, oh, you mean specialized? Oh, you mean like there are some toothpaste aimed for like gum care or sensitivity, like the Sensodyne. These actually have active ingredients to stop sensitivity. The ones for gum care sometimes have an antibacterial agent that helps remove like some of the bacteria. But then you have all that stuff with like, bicarbonates and charcoals and strawberries and stuff like that. And these are just the things that like I said, they're mainly advertising scams. Now, I'm really sorry guys, but I'm gonna just answer the last question about halitosis someone asked me, which is bad breath. So I'm just gonna speak just really quickly about it because I gotta run at 4:30, and I'm pretty sure some of you have like meetings around the same time. So I guess we can all just exit together. Halitosis is basically bad breath. So that's the medical term for bad breath. There's a lot of reasons for that. It can be because of food agents, like, having things that are just astringent. It can be because of acidity or gastric reflux. And so that's also common sometimes in children. It can be as a manifestation of things like cold and flu, post-nasal drips. Some people who have phlegm always piled up, you'd find that they are more likely to have bad breath. It can be because of poor oral hygiene practices. You're not brushing enough. There's food debris in your mouth, debris in your tongue. It can be caused by dehydration. You're not drinking enough water, so that can also cause bad breath. So there's a lot of reasons to have bad breath, and it can be just infections from the gum. Like you have, a lot of open cavities that are not restored. You have gum disease, a lot of abscesses and whatever in your gums. That would definitely cause bad breath. So it is a multifactorial thing. Now, first we have to see if there's any underlying problem and solve that. So if you have, like acid reflux or whatever, so you need to solve the actual problem. Another thing we generally tell the patients, stay hydrated, make sure you're brushing effectively, brush your tongue, use mouth rinses, and then frequent sips of water during the day. So, and obviously avoid food that cause bad breath, like, garlics and onions and stuff like that, like all the yummy stuff.
Thank you.
All right, guys. So
Thank
you're
you,
most
Rana.
welcome. It was really lovely to see everyone and meet everyone. I'll be more than happy to answer all the remainder of your questions on the group. Shireen, thank you so much for following up. Thank you so much for arranging this. It's nice to finally see everyone in face to face. And inshallah, I look forward for more great things. Thank you, guys.
Thank you. Thank you for
Thank
the
you, Rana.
I said, and you have a nice smile.
Thank you.
Yes, yes.
I mean, I'm a dentist, I have to, right? But
You
again,
have
see,
to.
and as I told you, the
Right.
genetic factor, that's where it comes
So
in.
you need
Yeah,
it.
the teeth are shining.
So you need it.
Thank you. Thanks so much. Thank you.
Thank you, Rana.
Bye-bye.
Thank you for your
Bye.
time. Keep well.
Bye.
Bye. Thank you.
See you all again.
Yes, soon.
Next
Soon.
month.
See you all. Bye.